Hey guys, today we're going to be doing our hip evaluation and corrections. We might do some shoulder mobility and neck mobility. This is Rick, he's going to be helping us out today. So we're going to start with that high elevation, elevated hip to see if one side is higher than the other, if that needs a correction. So Rick's going to go ahead and turn around, face the window for me. Awesome. And then go ahead and give me a little micro bend in the knees. You want the bend to be like super minuscule, and feet should be where they sort of naturally go. If people stand really, really close together, you want them to be closer to hip distance. And if they have an ultra wide stance, these are all things just to take into consideration for your own evaluation, but you want them pretty much hip distance apart. A great time to also notice if they have medial or lateral rotation of the foot or ankle. So now we're going to palpate the top of the iliac crest. This is going to tell us if one side is more tight than the other, and then this is also where we check our first stop for checking for a high elevated hip. So he is a little tighter on the left side. Currently, he doesn't really have an elevation at this point. Now I'm gonna come down to more like SI joint area, that PSIS, and I'm gonna check there. Now we do see an elevation in that area, so he is definitely high on the left. I don't know if that shows on the camera or not, but he's at least a ½ inch off there. So now that is checking for that high hip. So I know his left side is high. I'm gonna write that down, and then we'll check for the next thing.